Welcome to Sidelined, your dose of analysis on the biggest injuries and conditions affecting sports today. Featuring insights from the doctors of Palm Beach Health Network Physician Group in partnership with ESPN WestPalm. Now, here's your host, David DePino.
Welcome to the Sidelined Podcast. We're here with Dr. Zachary McVicker, sports medicine, Paley Orthopedic and Spine Institute in West Palm Beach Gardens, and as well as soon to be an office in Jupiter. Dr. McVicker, welcome to the Sidelined Podcast. How are you doing?
I'm doing well. Thank you for having me.
And thanks for joining us. In the world of sports, what are some of the most common ACL knee injuries? I know that's one of your specialties.
Yeah, that's correct. So the ACL, the anterior cruciate ligament in the knee, it can range from a simple sprain to a full rupture. And generally with athletes, it's more the latter, where the ligament is just completely torn, and then requires some treatment after that.
Let's talk about that treatment. How do you provide treatment for an ACL knee injury?
So the gold standard, especially for a professional athlete at this time, is a reconstruction of the ACL, and we generally use tendon that's harvested from the patient themselves. So it's called an autograft. For me, I use something called bone patellar bone or quadriceps tendon, either one. And then we create a new ACL with the use of arthroscopic equipment, meaning minimally invasive, through a scope and camera and as small poke holes as we can to get the job done.
And those tendons, did you say some of them are taken from the quadriceps, or are there other areas as well?
Yep. So the hamstring tendon is a popular one. The bone patellar bone, which is your patella tendon, that's the gold standard. That's the one that's been around forever, and is still very popular and the most used. And then more recently, there's quad tendon, where we take a little strip of the quad and maybe a little piece of bone, and again just shuttle it through a couple bone tunnels and remake the ACL.
Fascinating explanation. It's amazing, medical technology and the amazing work that surgeons like yourself do. You're also at the forefront of ACL care and now using the latest in this type of treatment. Can you tell us about the Bear implant, how you use it to repair the ACL, and how it works?
Yeah, so this is a very interesting change in ACL care. This is the first implant that was FDA approved that was completely de novo, so that's what they market this as. So they weren't piggybacking off of any other implants or any other instrumentation. So what it is a type 1 collagen from bovine source, which is cow, and what it does is it allows the surgeon to take a stump of the ACL, and it provides a scaffold for the ACL to grow back to where it needs to. So what we do is we dunk the ACL stump after we secure it into this collagen and attach it to the appropriate site for it to grow back. And over many months, that's what occurs. The ACL grows back to its original footprint. The problem with an ACL, when you tear it before this implant was there, it was bathed in synovial fluid, which is the fluid in the joint. And so then you think about this kind of mop ends just kind of floating around in this fluid, and it's not going to grow back to where it needs to because there's no signaling, there's nothing to guide it. So it just kind of scars in wherever, and that's the problem. That's why reconstruction was always the answer until this came along. And this is, it's been a really interesting implant. My patients are doing very well with this so far, and it's going to be interesting to see how, as this gets more popular, how the research comes out and how people are doing.
Yeah, I literally found out about it and looked it up, and then you joined the Paley Institute and you started doing it. So that's an amazing opportunity, for the latest and greatest in sports medicine care. I know each case is different, but what is the timetable for recovery from an ACL injury, like a typical timetable for recovery?
Yeah, we generally say 9 months. That's the absolute return to sport. Some people are a little quicker. Some people will take a little longer. And it's really to allow the graft to mature into your own ligament, see the stress that it needs to, and really become its own. Now, that's with excellent PT and clearing all of the return to sport play criteria. And so, generally a good rule of thumb is 9 months.
Besides ACL care, what other types of sports medicine do you provide?
So I treat a lot of athletes for hip problems that were Even now, people will tell them, you got to wait, just live with the pain until you need a hip replacement. So what I do is something called hip preservation and treat a lot of people with hip impingement. It's formerly called femoroacetabular impingement and labral tears in the hip that can cause a lot of debilitating pain and dysfunction throughout the whole pelvis and spine. So I treat a lot of people for that and do this minimally invasive with an arthroscope as well. And we treat a lot of shoulders, for rotator cuff tears and labrum injuries and elbows as well. And then any other ligament and knee problem that you have.
And if you're looking it up at home, you can type in FAI as well as a great acronym for that. I won't try to pronounce that that type of hip care. You mentioned all types of hip care that you provide, and I've been watching Andy Murray overseas. I mean, I don't know. I know he was doing well in the Australian Open, and he had a type of hip treatment a few years ago that actually served him right out of retirement, kind of boosted him right out of retirement. So that's definitely encouraging for athletes, as not only older athletes like myself, but also younger athletes like you said. You don't only treat athletes though. What age range of patients do you treat, and do you have to be an athlete to see you?
I mean, the weekend warriors, anybody that has an injury. So I provide care to basically anywhere from it could be 10 or 12 to up until 80s. I mean, I've done some sports medicine cases on some very active older individuals and got them back to playing tennis and stuff. So there's really no age range, there's no cutoff. It's more of activity level and goals and what's going on with the injury. So we treat a wide range.
Here in South Florida, very active population.
Absolutely.
So yeah, that's a great resource we have in Dr. Zachary McVicker, sports medicine specialist at the Paley Orthopedic and Spine Institute in West Palm Beach Gardens, Jupiter. Lastly, you served as an assistant team physician for the Los Angeles Rams, the Dodgers, the Galaxy out there, their football club, LAFC. I love watching those games.
Yeah,
they're
great.
The most pumped crowd in the whole thing.
That's awesome.
The women's basketball, Los Angeles Sparks, hockey, Anaheim Ducks, the Angels, as well as USC football. In Jupiter, served as assistant team physician for the Marlins, the single A affiliate, the Hammerheads, and the Jupiter Hammerheads, I should say, and team physician for Jupiter Christian High School.
Correct.
Can you talk about those experiences?
Very unique experiences. Gave me a lot of insight to how to especially when I was out in Los Angeles, how to treat these high level individuals who have a lot of demand and have timelines and stuff, and how to manage the mental aspect of it, and maybe a little bit of some egos and stuff, and it's all important in the treatment of athletes. So I got to work with some of the giants in sports medicine and learn from them. Here, I've been working with the Miami Marlins and still do. And it's a wonderful experience to be around the baseball players and help them through spring training as they're in Jupiter, and as well as their single A affiliate. We have a lot of fun, and when it comes time, we work hard and take care of the athletes.
Yeah, great experience in athletic care. Again, Dr. Zachary McVicker, fellowship trained sports medicine physician specializing in minimally invasive arthroscopic surgery, the hip, knee, shoulder, and elbow. Dr. McVicker, thanks so much for joining us on this podcast.
Thanks again for having me.
I just want to give out Dr. McVicker's info. Again, it's paleyinstitute.org, or you can call 561-844-5255 to learn more about Dr. McVicker or request an appointment with his office. And we'll see you next time on the Sideline Podcast.